story this week is, I feel, not too dissimilar from last week. So similar bad news on cases, similar good news on the vaccination front. I talked last week, and actually I think the last couple of weeks, really focusing on this slide of what the Ontario Science Table was predicting we would see. That variant cases would over time start to grow faster and faster. Our non-variants of concern would decrease over time, and the sum total of that would look like cases are overall going down. Eventually they would flatline, eventually they were going up. And last week I showed that really in Ontario as well as in Niagara, we were really seeing ourselves starting to head up in that view. And I think that's even more apparent this week. So if we're looking at just at the variant cases on an Ontario-wide basis, you can see they continue to trend upwards. And you can tell, this is not a straight line going up. It is gently starting to increase in the speed with which it's growing. When we look at our non-variant cases in Ontario, we've had it come down and it's sort of flattened out and is largely flat, if maybe just a tiny bit going down at most. And so when you add in the growing variants on top of this flatlining non-variants, you end up with this pattern where overall cases are starting to go up in Ontario, and they're looking, as you can see, going up fairly sharply. This is really, from just the last couple of weeks, we've had quite a substantial increase in the number of cases, going from averaging around 1,000 a day to now, being around 1,600 to 1,700 a day in terms of cases. The Ontario Science Table has a dashboard on their website, and they kind of show this similar pattern where your non-variant cases have come down and kind of flatlined, and the variants are really going up at quite a sharp rate at this point. And the predictions are that that's unfortunately going to continue on for a while, and the Ontario Science Table put out a few different models of where this could go. The one good thing I guess we can see is that if we're looking at where we are right now around the 22nd, we're still a little under 2,000. So maybe we're not as bad as the purple and the orange scenarios were. We're somewhere between the orange and the green scenario. But nonetheless, it is going up, and we can expect it's going to continue to go up for a while. And the reason in the number of cases is of concern is, of course, a fraction of cases get severely ill. They need to be in the hospital. They need to be in ICU. And a small percentage will also unfortunately pass away. And so what we're going to see is that as cases go up, we're eventually going to see ICU admissions start to go up as well. And significantly, in Ontario, when we came out of our second wave here, we never really got our hospitalizations and ICU beds empty. If we look back to the summer and entering into the fall, things were a lot lower in terms of our COVID cases. We brought them down, but we never really emptied out our hospital and ICU beds. So if we do go into a third wave now, we're starting from a point where our hospitals are already quite stretched, and they're not going to have the capacity to really handle that as well. In Niagara, we're fortunate that we don't have very many people in the hospital or in the ICUs yet, but in other parts of the province, this is much more of an acute concern. And Toronto is one example of that. And there was headlines over the weekend about how Sunnybrook Hospital is starting to actually build a field hospital out in one of their parking lots because they're expecting they are not going to have the hospital beds that they're going to need anymore. Hamilton Health Sciences has also begun doing some preparatory work in one of their parking lots, looking at seeing if they can put up a field hospital there. And a couple other hospitals back in January, going into the second wave, actually established field hospitals, including Joseph Brant Hospital in Burlington and the London Health Sciences Centre in London, Ontario. And so they already have field hospitals ready to go. And so it's obviously very concerning to me that our hospitals see that they are going to be even further stretched coming up and not going to be able to handle the volume, and they're needing to take these kinds of steps to get ready for this potential third wave. Looking specifically at the Niagara context, in terms of our variant cases, we have of course seen the growth of variant cases. Last couple of days, it hasn't been as high as it was previously. Not sure if there's a reporting delay that's going to fill in this and bring it back up, or if we've actually had a slight decline in our variant cases over the last few days. Looking overall at our case trajectory, when we look even at our non-variant cases, they do seem to be trending upwards here in Niagara. And then of course, when you add in the growing number of variants on top of this, of course, we have a quite a large gap. And that gap between our non-variants and variants is probably third of our total case count at this point. The growth in cases that we're seeing Ontario-wide, we're seeing in Niagara is, of course, since it's Ontario-wide, you can expect it's happening elsewhere. And I think it's useful to maybe take a quick look at our general neighborhood around the Golden Horseshoe to see what's happening in terms of where they are in terms of cases per week per 100,000 population. I picked basically starting at Durham region and coming around the Golden Horseshoe to us. And I've drawn in, what the province is using as the thresholds for their yellow level, their orange level, and the red level, just as benchmarks to kind of get a sense of what's happening here. So, as you can see in Toronto, York, Peel, those hotspot regions, they are well above that red level threshold. But you can see even Hamilton is well above that. And Hamilton is actually at this point slightly above the Toronto case count. And so they're becoming actually the #2 spot in Ontario in terms of cases. And of course, being right across our border, that's a very big concern that we're going to see a spillover and an increase in cases here as a result of that. I think it's also notable that our entire neighborhood here, everybody is above that red level threshold of cases at this point, and everybody has been trending upwards over the last little while to reach to that point. Significantly about the cases that we are seeing right now in Niagara is that back in the fall, we had lots and lots of outbreaks, and a lot of our cases were tied to those outbreaks. We are still seeing a large number of outbreaks, but the number of people affected in these outbreaks is very small. In fact, I think a majority of our outbreaks are fewer than 5 cases, which is certainly good, but that also means that most of our cases are out in the community, spreading in the community, which does actually mean that it's a more difficult environment in which we're going to control our cases. And it does mean that there's more people infected out in the community that potentially could spread that infection to others. And I think that's going to be, a particular risk for us going forward, that there's more risk that people are out in the community potentially infected with COVID-19 and spreading it out in the community, as opposed to what we saw in the fall. And so actually being at the number of cases we are right now, in some ways actually portends, faster growth going down the road than we perhaps would have seen in the fall with that same number of cases where close to a third to a half of those cases might have been in a controlled outbreak environment, such as a long-term care home. The reason cases are spreading in the community like this is, of course, due to the interpersonal social behavior that we're all partaking in. And we've seen, as we've gone through lockdowns and come out of lockdowns, people's, being out and about, going shopping, participating in recreation has varied. When we were in the first lockdown, of course, it came down quite strongly. Our second lockdown in December, January, it's come down strongly. But as you can see, it is very quickly recovering now that we have left lockdown. And with more people out and about, more people interacting, that's creating the rise of infections in our community. And to see the flip side of this is, of course, to see people staying home. Lots of people stayed home during that first lockdown, again during the second lockdown. But as you can see, people are staying home less and less. And we've actually really returned to where we were in the fall now in terms of people's behavior, in terms of staying home. I imagine as the weather gets nicer, that's going to happen more and more with people outdoors, which does at least have a benefit of people being outdoors spending their time versus indoor spending their time. But it does still show that we do have a lot of people likely partaking in social interaction away from their home. And that's, I think, what's going to be really concerning over the next couple of months for us. A couple of months from now, as I mentioned, we're going to have more people vaccinated, particularly the 60, 70-year-olds who are greatest risk of being hospitalized. We're going to have the heat and the humidity of summer really helping us control cases. And I think in a couple of months, things can actually really loosen up a lot. But we need to get over the next couple of months without seeing a third wave, without really having to go into another lockdown. And that's only going to happen if everybody really pulls together to once again have that resolve to stay home and limit our activities outside of the home to just those essential ones, so we don't see the interaction that allows infection to spread. So that's the story around where our cases are going. I'll quickly touch on the good news then around how vaccine rollout is progressing in Niagara. So these are the 3 phases of the province's vaccine rollout: the first phase, the second phase, and then the third phase. And as you can see, we've worked through the first couple of groups in that first phase, and we're actually finishing off work on the last group in the first phase. The provinces, of course, open up vaccinations now to the 75 to 79-year age group. So we've actually entered into the second phase while we're still finishing off the first phase. And we've also begun some vaccination amongst shelters. And this week we'll be doing vaccination amongst some of our migrant farm workers in developmental sectors. So getting us started into some of the other groups within that second phase. But of course, the 75 to 79-year age group is going to be a big part of this group. In terms of our progress vaccinating the 80+ age group from that first phase, we've made really good progress with that group. At this point, if we're looking at the latest Statistics Canada estimate of our 80+ population, we've got the equivalent of 59% of them already vaccinated. And then between Niagara Health having about another 12% booked into clinics, and us in public health having another 29% booked into clinics, we have almost the entire 80+ population in Niagara either already vaccinated or in the queue to get vaccinated, with only a small group potentially that hasn't yet been reached and gotten into the queue for vaccination. So this is really great news. We're moving quickly through this group. We've got the people who most need to vaccinating into the queue, and hopefully we'll continue to see this green part of the pie basically eat up the rest of it over the next couple of weeks. With everybody basically in the queue in the 80+ group, we of course are now focusing a bit more on getting the 75 to 79 group into the queue as well. The province launched the opening of vaccination, booking for them into vaccination clinics this morning. Starting this morning, we've actually already hit 7% of our 75 to 79-year age group. And that's through some of the work that we've done vaccinating within retirement homes, long-term care homes, where some of the residents might have been in their late 70s. As well, Niagara Health has been reaching out to family doctors over the last couple of days to start to get those clients into their clinic as well, and a few of them have been vaccinated. With Niagara Health booking up some of that population, we actually have another 5% of them already booked into Niagara Health clinics. And as of the end of this morning in public health, we got about 22% of the 75 to 79-year age group already booked into our clinics after just a few hours of registration being open. So we're making very good progress with almost closing in on actually a little over a third of our 75 to 79-year age group is already vaccinated or in the queue to be vaccinated already. And so over the next few days, hopefully we'll be able to get this donut looking very similar to the 80+ donut, where we have most people getting into the queue for vaccination. We still have lots of appointments available for people who want to get vaccinated. As of this morning, we've mostly filled up our final two Niagara Falls clinic stays. There's a very small number of appointments possibly still left there. We have a small number of appointments at our Welland clinic on the Thursday with it full the other 2 days, and we're full then through Grimsby. But once we get into Fort Erie, Niagara-on-the-Lake, and the clinic at the Brock site for St. Catharines and Thorold, we still have actually a fair number of appointments, and we'll hopefully be seeing many of our 75 to 79-year age group residents quickly book into those. So, we're hoping that by the end of the second week of April, we could largely have both that 80+ group and the 75 to 79 age group almost all completely vaccinated. And we have enough appointments to pretty much accommodate all of the people in those two age groups right now. Last thing I just want to comment on is there was some news out of the United States this morning around some of the AstraZeneca trial details. And I think AstraZeneca as a vaccine is taking a bit of a hit over the last week or so in terms of some of the public confidence for it. And the US was showing that in their data that they saw about 78% effectiveness for that vaccine. That mirrors very closely to what we are seeing in terms of the efficacy in the clinical trials elsewhere in the world, or is close to 82% effective. And more significantly, I think, that vaccine is 100% effective at preventing death and preventing hospitalization, which is the most important thing that we want to see this vaccine do. I think significantly, the US data that was released this morning shows that the vaccine was equally effective in the elderly population as it is in the general population. And so some of those concerns that were initially present, where maybe this vaccine didn't work as well in the 65 and above population, I think continue to be disproven, and there's more and more evidence that it does work well. That's the US data. In the United Kingdom, they've got 11, 12 million people vaccinated with AstraZeneca, and there again, they're seeing it's working really well in that 65 age group. And so this is one more vaccine we have that really can go to any adult, and it's going to have a real good impact. And so we have 4 really great vaccines here in Canada. And one other thing that I think was significant about AstraZeneca was there's a lot of talk about the blood clot issue, where they had a couple of people in the European Union who had blood clots. And after a more full review of the data, that really does not seem to be a significant concern. And it looks like the rate of getting those blood clots is equal in the people who've been vaccinated versus the people who are not vaccinated. That's just in the background, right? And unfortunately, there's a coincidence where a couple of people got those blood clots shortly after getting their vaccine. So it looks like all 4 of our vaccines in Canada are very safe, very effective, and most importantly, they're going to make sure people don't die and make sure people don't get hospitalized. And so if we're looking at a vaccine to get, my opinion is the first vaccine you can get is the best vaccine you can get. The first vaccine you can get will give you your protection from dying, your protection from hospitalization right away, and also make sure that you're not going to potentially pass infection on to people in your household or your social contacts who might be very vulnerable. And so hopefully, as we get perhaps AstraZeneca and even the Janssen vaccine coming out to Niagara, we'll have more and more options for people to get vaccinated, and everybody will quickly take the first opportunity they have to get vaccinated, because the faster we all get vaccinated, the faster I think we can start to relax some of the measures we have in society to prevent COVID-19, and we can start to move back into something a bit more normal in terms of our lives. With that, I'll turn it over to you, Meredith, to handle questions.
All right, thank you, Dr. Hergy. So same process as usual, 1 question, 1 follow-up. We'll go through a round. If we have any time left, we'll do another lightning round at the end. So Ludwig, you are up first, and let me ask you to unmute. You should be good to unmute now.
Sorry about that. Can you hear me now?
Yeah, you're good.
Great. Okay. New week, new headset. Dr. Hergy, thank you. I just jumped at something you said there regarding the percentage of community spread, community cases as opposed to outbreak cases. So did I understand you correctly when you said that most new cases that you are seeing now are actually coming from the community and you don't have a known source for those? And if so, I imagine that you have been asking these individuals some questions about what they have been doing. So if you could expand a bit about, is that correct? And if so, what stories are you hearing from these cases coming in?
Yeah, no, good question. And I think there's some confusing terminology where we talk about community transmission, which is transmission where we don't know where the source is, versus cases being in the community, which is people who aren't in an outbreak setting, they're living out in the community, but they may have community transmission or they may have transmission to a known contact. And what I'm talking about here is that 80% of our cases are living out in the community. They're not part of an outbreak, but fortunately, in the majority of these cases, we are able to link back to where the source of infection is. Overwhelmingly, what we see as a source of infection for people remains household transmission. You know, I'd say 30 to 40% of cases are receiving their infections from contact with someone else in the household who's become infected. The other big group, though, that we're able to trace back to is people having some sort of social interaction with other people. Meeting with coworkers, meeting with friends, meeting with extended family, and infection spreading amongst those social groups. And that, I think, goes back to what I was really emphasizing about the importance of us cutting down on those social contacts and really just sticking to our household. It's impossible, really, probably to break off our social interaction with our household. But if we're able to break it off with everybody else for at least just a couple more months, I think we can avoid a third wave and we can get to a point where we'll actually be able to really relax and really recalibrate everything. But that's only going to happen if we break off those social contacts for the next little while.
And do you have a follow-up, Ludwig?
Yes, thank you. Yeah, just as an observation, I drove to Toronto this weekend just to complete some errands, and the patios are packed. There's people everywhere sitting quite closely. So that's what that is looking like downtown. What I'm wondering, Dr. Hergy, when you say just a couple of more months, then we can start to relax, recalibrate, what could that look like? I mean, you're saying that just asking for people to just keep it up for a couple of more months. What could we possibly be looking forward to in terms of actual things that we can do together once those 2 months pass, if we're successful?
Yeah, no, great question. So, a couple months from now, more people are vaccinated, a lot less risk of the people who are most likely to be hospitalized, that getting hospitalized because they've been vaccinated. As well, we have the heat and the humidity that will slow down the spread of infection. What I'm hoping is that at the very least, we basically go back to what we were experiencing last summer. We weren't limited to just our households. We had, a wider social circle. We had, indoor dining in restaurants, not completely open, but a fair bit open. We had a lot of our businesses that have had to close start to be able to reopen. And that's what I hope to see, at least at the very minimum. I think we'd probably want to take it on a slow stepwise basis to see how far we can go. And we'd have to basically base it on conditions on the ground of what we're seeing in terms of infection spread based on that. But I really imagine that we could actually perhaps get to the point where we're no longer limiting our social contacts. We can actually have fairly widespread social contacts. I would suspect that, kind of the social gathering places that we normally have, a lot of those could really be back up and running. Expanding the capacity in malls. Cinemas could perhaps reopen. Maybe there would be some physical distancing still there, so you're not actually packing the full capacity, but at least having them open so people can start to attend them. Live theater, something like the Shaw Festival, something like that perhaps would have the opportunity to go ahead in some fashion. Again, maybe there'll be still some restrictions on the total number of people who can sit, but at least it wouldn't be completely shut down. And then as we get more and more people vaccinated, hopefully we'll be able to continue to scale back and actually lead to even more freedom going forward.
Okay, thank you, Ludwig. Up next, we have Paul Forsyth.
I think Paul is muted.
Can you hear me?
Yeah.
I apologize. I had technical problems, so I missed most of your discussion today, Dr. Hergy. So I'll have to catch it on the website. But I thought I'd check quickly with you. I was walking my dog in Solar Subdivision in Niagara Falls yesterday. There's a playground there with a massive, as Ludwig said, a crowd of people in very close contact. No masking. It was. In one sense, it was heartening to see that. At the same time, it's a little disturbing to see that kind of very close proximity crowding. You mentioned that with the warmer, more humid weather, that's a deterrent for the virus spreading. But on the flip side, a beautiful day like yesterday, we had a huge crowd of people. Is that your concern that with the weather turning more to spring, that could allow people to let their guard down and just mingle far too much, and that could lead to possibly the third wave?
Yeah, so we're already seeing people likely interacting more, and so we're already seeing cases heading upwards into a possible third wave. I think as the weather becomes a little warmer, it could actually go two different directions here. One is it may give people, feeling that they're wanting to get out of the house more. And when they get out of the house, it really depends what activities they're going to partake in. If they're partaking in very social activities, that's going to be a concern, and you can see infection spreading. The flip side of that is if people partake in activities where they're just going to interact with their household and they're not really going to socialize with others, I think that actually is a really good thing. That'll, we know in the outdoors, the risk of infection is less. If people are going to go on hikes or they're going to go on bike rides with their family, they're going to do something with their family and not interact with others, I think that's a way for actually people to continue to limit their contacts to just their household, having a wider, set of activities they could partake in. So hopefully they're not getting bored, and so they'll have the incentive, hopefully, that they can, participate in some of these other activities rather than being bored and dealing with a frustration of not being able to do anything. And so if we go down that route and people, partake in activities with their household, I think actually that could help us get through the next couple of months where we don't see increased social interaction and risk of spread of infection, but we actually give people an outlet where they can send some of their, cabin fever and able to actually partake in activities that are going to be safe.
And a follow-up, Paul?
I'll hold on. I'll decline for now because as I said, I'll have to watch the video to hear what was said. I don't want to be asking the same questions that were asked.
Okay. Perfect, thank you. Penny, you're next. Should be able to unmute now.
Yes, thank you. When Dr. Hergy, when you were answering the question about what you thought Niagara could look like in 2 months if we all did what we were asked to do. You talked about fewer limits on social contacts and that sort of thing, but you also then went on to talk about social gatherings such as cinemas, malls, even live theater. You're not, are you, I feel like I missed something. Are you talking about that 2 months from now, or are you talking about that at some point in the future?
Yeah, I'm talking about that I could see the possibility that kind of thing might be possible even 2 months from now.
Really?
I, hope that if, it all depends how quickly we get vaccinations out, but I think there's a possibility enough people could be vaccinated. With that, plus the assist from the heat and the humidity, we would actually be able to relax at least to that extent.
And a follow-up, Penny?
Yes. So I watched the update from Friday with the regional councillors and mayors, and you mentioned that you were feeling a little pessimistic as we entered this third wave about what was going to happen. You're actually sounding a little more optimistic right now. Is that because of the good news about vaccinations, or do you still have concerns about how important it is for us all to do what we're being asked to do while we wait for a greater number of people to be vaccinated?
Yeah, I think I'm pessimistic about the next couple of months in our ability to get through these 2 months without triggering a third wave. I think if we get through these 2 months, I'm very optimistic for what the summer could look like. But it's all a question of what we do now that affects what happens over the next couple of months. If we continue with what we're seeing here with a trend of people being out and about more, socially interacting more, and that leads to a second wave, that could mean that 2 months out, we're actually near a peak of a third wave, or our cases are still high and we're going to be in a lockdown, and our ability to start to enjoy the dividend of that summer is going to be delayed as a result. I think at some point we're going to get to a point where things get much better. If we're able to keep cases controlled over the next 2 months, I think that actually arrives about 2 months from now.
Thank you.
Okay, thanks, Penny. Up next, we have Bonnie. Just let me find you on the list here. There we go. You should be able to unmute now.
Hi, guys. Thank you for hosting this. Dr. Hirji, are we still exclusively using the Pfizer vaccine?
No, we're not. We've received a very small amount of Moderna vaccine, so we have used some Moderna vaccine here. Overwhelmingly, though, it's still Pfizer vaccine.
And is there a sorry, hopefully this can be included in my first question. Is the Moderna doses, are they being delivered in St. Catharines or at the mass immunization clinic in the Falls?
They're being delivered at the public health immunization clinic. So we've used them at the Niagara Falls clinic over the last few days. Currently, Moderna is actually being delivered only to us in public health. It's not being delivered to the hospital. So largely it's going to be just us who uses it, not the hospital.
Okay. Am I allowed one more, Meredith?
Yes, just this one.
Thank you. Dr. Hirji, I'm sure you saw some of the coverage last week on how the variant cases are impacting the younger age groups. Mm-hmm. Are we seeing that trend here in Niagara? Are you seeing people hospitalized in Niagara younger than what we've seen in the past year?
It's a good question. We've definitely seen a few hospitalizations in younger people. I'm talking there more in the 30s, 40s and getting younger than that. We've also had a couple of ICU admissions in that age group. I haven't actually had us do any statistical analysis to see if that's actually statistically different than what we are seeing through the fall. We have periodically seen hospitalizations and ICU admissions in that younger age group, and we know it does happen. So I can't say if necessarily it's worse than it was in the fall or not, because we haven't checked for that specifically, but we've definitely observed at least a little bit happening.
Thanks, Bonnie. And Richard, over to you. You should be able to unmute now.
Hey, everybody. Yeah, thanks for putting this on again. My question is, I've heard you mentioned that we could possibly avoid a third wave by, continuing to keep the numbers down. But then I've heard that we're also kind of in the third wave. So can you just clarify that for me? Are we in a third wave? Are we headed towards one? what's the consensus there?
Yeah, I think this is a bit of a judgment call of how you want to describe it. There's no clear definition of what is a wave, what's not a wave. It's kind of what you look at over in the eye of the beholder, looking back at what's happening. I think what everybody agrees is cases are going up right now in Ontario. They're going up in Niagara. If you want to call that a surge, you want to call that the start of a third wave, you want to say that we are in the third wave, I think it's a judgment call of how you want to characterize that. The key thing, though, is cases are starting to go up and they're going up relatively rapidly. So that is consistent with potentially going into a third wave.
And a follow-up, Richard?
Not really. What would you say? How would you characterize it?
I've been characterizing it as what is, increasing cases that is potentially a third wave. We'll only see after the fact whether or not if it went really high, that was a third wave, versus we were able to curb it and it looks like just a small ripple.
Okay, thanks.
Okay, Gord Howard, over to you next.
Hi, Dr. Hergy.
Hello.
With the growth of the variants, are you surprised that we don't have more outbreaks and bigger outbreaks and more hospitalization at this point? Like, are we on the verge of seeing that spike as well?
Yeah, I'm not necessarily that surprised we haven't seen bigger outbreaks. The kind of settings where we're most concerned about outbreaks are where we really prioritize getting vaccinations in. Long-term care homes, retirement homes, other kind of congregate settings where there's lots of seniors. We've vaccinated in some of our shelters. So the places where you have lots of people close together where infection could spread into being a big outbreak, we vaccinated. And I think it's a testament to how good the vaccine is that we've been using that we've not seen those larger outbreaks. The outbreaks we see tend to be in the kind of settings where we don't expect infection to spread as easily. So workplaces where there's actually not that many people who actually work, so it actually can't spread to too many other people, for example. So I'm not too surprised at the number of outbreaks. I am a little surprised at how well we've done in terms of hospitalizations and people being admitted to ICU. We've been sitting around only about 10 people being in the hospital. It's expected normally that about 10 to 20% of cases would require hospital care. So if we're doing 20 to 30 cases a day, we're expecting probably 5 to 6 people every day would ultimately need to go into hospital. And what we're seeing is actually it's a bit less than that. So that's certainly some good news thus far, but I do worry it's some luck of who's been getting sick, and maybe that luck is going to run out on us at some point.
And a follow-up, Gord?
Sure. A couple of weeks ago, March 5th, it might have been, when the province named 13 hotspots that would share, I think it was 920,000 extra doses of the vaccine. Have they arrived in Niagara yet? And do you know what Niagara's share of that extra vaccine is?
Yeah, I'm not sure how they're dealing with the 920,000 doses. If that's just kind of lumped in with our usual allotment of vaccine, or if that's going to be a special pool. Hasn't been flagged to us that we've received that, but it's possible that, just general weekly delivery of vaccine, it's been added in there and it has been specifically flagged for us.
Okay, thanks, Gord. And finally, we have Don Mitchell from Global.
Thank you for taking my question, Dr. Hirji. I might be putting you on the spot by saying this, but you're saying Moderna vaccine is now being used in the region. Would you be able to ballpark what the percentage would be Pfizer to Moderna? And is it like 90% Pfizer or?
So I would say over the past week, it was probably on the order of 10 to 15% Moderna, and then 80–85% Pfizer.
Perfect. Thank you for that. And in terms of the actual limits that are set right now in terms of capacity in the red level, what's your assessment of that? Do you think those are good numbers right now in terms of, I believe it's retail is limited to 75% capacity and restaurants are now at 50%? In terms of cases rising now in the region, do you think those are good numbers?
Yeah, so I don't know exactly how those numbers have been derived, and I don't think there's a lot of science to say what is the right capacity. Obviously, the higher the capacity is, the greater chance that there could be interaction between people and the greater chance that you could see infection spreading. I would basically go from the perspective that we are seeing cases go up, we are seeing more spread of infections. And so whatever we're doing right now is probably not good enough. And we need to find places to curtail that. And one place where we could curtail that might be to reduce capacity limits further.
Okay, thanks, Don. So we've done a full round of questions. If anyone wants another question, can you please just let me know in the chat and then I will unmute you. Okay, Bonnie, you were up first. Go ahead.
Thank you. Just kind of following up on the last question, what was your reaction when you found out on Friday, like we did, that that the capacity limits would be changed overnight for restaurants?
Yeah, I was very surprised to see that. First off, just given how quickly that they put that in place, it seemed an unusual rush and not in keeping with the usual timeline where the province might arrive in something Friday and it doesn't kick in until the start of the next week. And it was also very surprising to me, given that we are seeing this trend here of cases are going up in Ontario. Obviously, we want to be finding ways to tamp that down before it turns into a third wave. And instead of seeing, some sort of increase in measures to reduce the spread of infections, we actually had our opening up of dining a bit further. So I thought it's kind of incongruous to what would be expected and what would be called for at this moment. There is one detail of what they're doing, which is a little, I think does mitigate what they did a bit, which is that they did create a rule that dining should only be amongst people amongst the same household, with a couple of exceptions. And that obviously mirrors what we have done here locally and mirrors what we have seen in terms of the risk of infection spreading amongst people dining. It's very much around the people sitting at the table. And so at least they did this by mitigating the who infection could spread amongst, to narrow it down to just the household. And I'm hoping as a result of that, maybe it's not going to have as bad an impact as it could have otherwise had.
Okay, thanks, Bonnie. And Gord, you had one more question.
The province recently, I guess they're doubling the list of pharmacies that can provide vaccines to people 60 and older. What are your thoughts on Niagara not being included in that, on that list?
Yeah, so they've announced the initial list where there was 3 pharmacies and there are 3 locations of pharmacy, 3 regions with pharmacies and 6 regions with primary care that got AstraZeneca vaccine. Obviously, I was disappointed that Niagara was not one of the areas that got AstraZeneca vaccine. Recognizing it is a pilot and it wasn't going to go everywhere, I can understand that. I'm just hoping that we don't see a repeat of what happened back in December, where they announced, 13 regions are going to get vaccine and it takes another month before they give it to any other region. As was noted, I think actually by a question you asked, that we are one of the 13 hotspots the provinces highlighted. I would really hope that in the next tranche of pharmacies and primary care offices they announce, that Niagara pharmacies and primary care will be part of that, in consistent with us being one of these hotspot regions.
Okay, thank you. So I think that's it for questions for this week. So thank you, everyone. If you do think of additional questions, please just email Courtney or Carrie or me, and we'll do our best to get them answered by Dr. Hergy as soon as possible. And we will see you all next week.